So today's medicine topic is seizures and epilepsy. In seizure, we have, first of all, we have its definition. Now, talking about definition, what is a seizure? A seizure is a transient occurrence of signs and symptoms. It is a transient occurrence of signs and symptoms. Whenever you are asked about seizures, first of all, remember these two terms. So today's medicine topic is seizures and epilepsy. In seizure, we have, first of all, we have its definition. Now, talking about definition, what is a seizure? A seizure is a transient occurrence of signs and symptoms. It is a transient occurrence of signs and symptoms. Whenever you are asked about seizures, first of all, remember these two terms, which are signs and symptoms. It is a transient occurrence of signs and symptoms due to the abnormal and excessive synchronous neuronal activity in the brain. Okay, now what are seizures? Seizures, they are basically the transient का मतलब है जो थोड़ी देर के लिए होता है. Transient occurrence of signs and symptoms due to abnormal and excessive synchronous neuronal activity in the brain. It is the transient occurrence. Okay, थोड़ी देर ले होता है seizures. Transient occurrence of signs and symptoms due to abnormal. It is the abnormal and excessive synchronous neuronal activity in the brain. मतलब कि synchronous. There is synchronized neuronal activity in the brain. Physiology behind the seizures. Now, what is the physiology behind the seizures? Okay, we have the definition. Then we have the physiology behind the seizures. There is imbalance between excitatory and inhibitory neurotransmitters. In talking about the physiology, now in physiology we have an imbalance between the excitatory and inhibitory neurotransmitters. There is an imbalance between the excitatory and inhibitory neurotransmitters. Okay, now what are the excitatory neurotransmitters? The excitatory neurotransmitters are glutamate, and the inhibitory ones are the GABA. Okay, now the glutamate, the excitatory receptor, it acts on the NMDA receptors and lead to calcium influx. Okay, glutamate acts on the NMDA receptors and it leads to calcium influx, whereas GABA, it acts opposite to that and it acts on GABA receptors only instead of acting on the NMDA receptors, and there will be an influx of chloride and there will be a chloride influx. Okay, end result is calcium or chloride influx. The imbalance between these influxes leads to seizures, which are transient occurrence of signs and symptoms due to abnormal and excessive synchronous neuronal activity in the brain. Now, what are the causes? In this case? What can be the causes of seizures? The causes of seizures, they can be trauma, any kind of infection, any kind of tumors, or इलेक्ट्रोलाइट एबनॉर्मेलिटीज़. ऑब्वियसली सीजर्स हैं, ठीक है, कोई ट्रॉमा हुआ ब्रेन को, उसकी वजह से हो सकता है. कोई इन्फेक्शन होगी ब्रेन में, क्या ब्रेन में सबसे पहले तो कैंसर ही देखते हो, ट्यूमर लिख दिया, उसके बाद ट्यूमर के साथ रिलेटेड इन्फेक्शन, ट्रॉमा, एनी काइंड ऑफ अदर एबनॉर्मेलिटीज़ रिलेटेड टू इलेक्ट्रोलाइट्स. नाउ व्हाट इज एपिलेप्सी? ओके, वेट, नाउ व्हाट इज दिस एपिलेप्सी? Epilepsy, it is 2 or more, okay, episodes of unprovoked seizures. Okay, unprovoked seizures. In epilepsy, there are 2 or more episodes of unprovoked seizures. 2 or more episodes of unprovoked seizures. Now, what is the classification of seizures? Classification of seizures according to ILAE 2017, recent one, by ILAE. ये तो आपने पहले पढ़ा ही होगा इन pharmacology. Focal onset and generalized onset. They can be focal onset and generalized onset. In focal onset, the normal activity begins, since it is focal, okay, which means the normal activity, okay, it begins in one hemisphere. The normal activity begins in one hemisphere only, whereas in generalized onset, there is simultaneous involvement of both hemispheres. Both hemispheres are involved, okay, simultaneously. In focal onset, only one hemisphere is involved. In generalized onset, both hemispheres are involved. Focal onset will lead to impaired awareness in the person. The person will not be much aware, and there will be okay, it can also happen without impaired awareness if the patient is lucky enough. Now, what is a generalized onset? simultaneous involvement of both hemispheres is seen, and it is always associated with LOC. Now, what is LOC? Definitely not line of control of Pakistan. Loss of consciousness. It stands for loss of consciousness. It is always associated with loss of consciousness, since there is more severe involvement of both the hemispheres. Now, it can, since focal was also divided into two, generalized onset related seizures, it can also be divided into two. First of all, motor, and then we have non-motor. In motor, we have tonic. Presents with sudden stiffening of muscles. In motor, generalized onset seizures, motor involvement is there. In motor involvement, when there are tonic seizures, in tonic seizure, it presents with sudden stiffening of muscles. Obviously, tonic means there is some tone, sudden stiffening of muscles, and the person falls backwards. Remember that. In tonic seizures, there is a sudden stiffening of muscles, and the person falls backwards. For example, this is that person who is standing. The person will fall backwards. Whatever. I fall. I fell. And tonic. After that, we have clonic. Repetitive contraction and relaxation of muscles. Repetitive contraction and relaxation of muscles is there. Rhythmic, which are usually rhythmic. In clonic seizures, in clonic motor seizures, repetitive contraction and relaxation of muscles is there, which is rhythmic, and the person is sustained in that position only. The person either falls, because relaxation is also there along with the contraction. In case of atonic, then we have clonic, then we have atonic. In case of motor, atonic. Sudden onset loss of muscle tone. There is sudden onset loss of muscle tone. Sudden onset loss of muscle tone is there in case of atonic. Loss of muscle tone, atonic, and the person falls forwards. So how to remember that? Tonic, atonic. TB, just remember the disease TB. इस person को TB भी था साथ में, पीछे गिर गया. The person who had TB, which means the person who had tonic seizures, fell backwards. That's it. And myoclonic. Then we have myoclonic seizures. In myoclonic seizures, there is again, just like clonic, myoclonic and clonic, they are kind of similar. But in myoclonic, the repetitive contraction and relaxation of the muscles which occurs, it is non-rhythmic. It is non-rhythmic and jerky, shock-like. Repetitive contraction and relaxation of muscles is there. They are non-rhythmic and jerky and shock-like. Non-rhythmic, jerky and shock-like. And tonic-clonic seizures. It is the most commonly remembered name, commonly remembered words whenever we think about seizures. Why? Because they are most common type, which is usually seen. Now, non-motor generalized onset seizures, in which absence seizures in children is seen. Pretty common. Now, doing the diagnosis of seizures. IOC. Now, what is the meaning of IOC? Investigation of choice. Now what is the investigation of choice? It is EEG, that is epileptiform discharges. Epileptiform discharges are seen. Epileptiform discharges are seen. Normal EEG. Now what are epileptiform discharges? Epileptiform discharges. Now what are epileptiform discharges? In EEG, the normal graph which is seen is somewhat haphazard like this, but in case of seizures, it is like a bit like this. It is so haphazard. This one is normal. This one is seen in seizures. After that, okay, normal EEG. Okay, if the EEG is normal, even then it doesn't mean that the person is not suffering from seizures. Okay, even though EEG is just an investigation of choice. Now, what is the management of seizures? For focal seizures in which where are the focal seizures? Okay, in which impaired awareness without impaired awareness is seen. In focal seizures, carbamazepine is a drug of choice. Okay, and in GTCS, generalized tonic-clonic seizures, okay, which is the most common type, lamotrigine or valproate is seen. Lamotrigine or valproate is seen. And in case of absence seizures, ethosuximide or again valproate. So valproate can be given in both these. Okay, GTCS and absence seizures. In myoclonic seizures, in which arrhythmic relaxation and contraction is seen, valproate, and again in atonic, valproate. Only difference is in focal, and rest in all, valproate can be given. Now here's the question. Now a 4-year-old child, okay, this is that child who is 4 years old, was brought to the ER examination room after an episode of fainting, and the father was actually giving the history only. The father told that she was standing in the kitchen. When did fainting happen? While standing in kitchen, when she suddenly fell down. Okay, the person fell down and the person became unresponsive for about 20 seconds, and then after that regained consciousness. Even the and I forgot to mention the interictal EEG. What is that? Now it is the inter means the EEG which is taken between 2 episodes. This is the time when EEG is recorded 2 episodes of seizure. This is when seizure happened and this is when seizure happened. The time between 2 seizures is when the EEG is collected. Okay, and it is also known as IED. Interictal epileptiform discharges are also seen in seizures. Now even the interictal EEG was abnormal. What is the diagnosis? Diagnosis options are A, tonic seizures, B, atonic seizures, C, GTCS, D, absence seizures. Now remembering the keywords. Okay, in suddenly fell down, episode of fainting, unresponsive for 20 seconds, and then the person gained consciousness. Just a quick recap of seizures and epilepsy. In seizures, the definition is transient onset of signs and symptoms due to abnormal and excessive synchronous neuronal activity in the brain. Now, what is the physiology? Imbalance between the excitatory and the inhibitory neurotransmitters causes tumors, trauma, infections, and the remaining is electrolyte abnormalities. In physiology, we saw the mechanism, the influxes, classification, focal onset, generalized onset, hemispheres involved. Then further, the generalized was divided into motor and non-motor. Motor is in which there is loss